Morning. I hate to disagree publicly with Beth but Beth was encouraging people who are in the classroom to get out of the classroom and come to the legislature. She's nuts. People who are in the classroom, stay in the classroom with kids. We need you. We appreciate you. If you want to run for office, come talk to us. We'll help you. But you're where you belong, and you know it. So let's give you those of you who we want to talk here about some of the specific issues we're here about today. So let me ask you, and shout it out, what are the issues that you're here about today? You guys are here. Why are you here? Education. Education? What else? Money. Money? Funding? What? Education? Good.
The system bill.
The system bill? State-funded centers, we hear about that? Child care. What else? Books? We like books? You want more books? Yeah, books are good, right? Okay. And ultimately, I think we're here about kids. And every year we come here to remind the 187 people who are elected to represent us that kids are important. And some of us have individual issues in our districts, in Danbury, or at state-funded centers, or if we're have a kid with Fragile X, or if we're working on healthcare issues. And this is one day a year where we get together and we go and remind our legislators that we live in your district. We vote for you, or our parents vote for you, and we're here to remind you that kids are really important. And that's the big thing. Tell your stories about why you're here, what you do every day. Remind them that the state's support of the work that you do is really important. If you have specifics, bring those up. It's a really interesting time right now. I think we have a governor who gets early childhood education, who wants to do the right thing. I think we have a legislature where people want to do the right thing. We've got real problems with money, and everybody's sort of trying to work it out right now. And this idea of, and you'll look in your packet, you'll see a picture. There's one, what the early childhood system looks like now, which is like your brain on drugs kind of picture. And then what it should look like if we got organized. And Senator Biden put this together to help explain to legislators. We've discovered that with legislators, it's good to have pictures and not so many words, as it is for kids, actually. This is really an example of how the state could be and what our vision is. And so remind them that the state spends a lot of money and we appreciate it on early childhood stuff, and we want to do it better. And what this bill is about moving that forward. The governor, in his proposed budget, spared a lot of programs that we were worried about. He didn't spare nurturing families as much as we would have liked him to, and some of us are going to talk to him and to our legislators about that. And his ability to deliver on this budget is dependent on the legislature trying to figure out where the money comes from. There's this sort of, it's like a checkbook, like we have, and you have to worry about what your income is and what your expenses are. The governor said this is what we want our expenses to be, and figuring out where the income comes from is a really big issue that our legislators are grappling with. The governor wants to get $1 billion out of people who work delivering services for the state. It's really hard. And the legislature's got to figure out, if he can't deliver on that, are they going to raise taxes on the wealthy? Are they going to go after corporations? Are they going to cut some other things? What are they going to do? So it's really important when we go around today to say, we like the kinds of things that are in the budget, and the legislature needs to work really hard to figure out how to fund those. And that's an important message to send. You also have, by the way, some talking points in either on your seat or in your packet. I don't know how we ended up. They're over here. You should make sure you grab one before you go, because this summarizes some of the key things. There are a bunch of other, Beth talked a lot about this consolidation bill, and that's a real priority for us this session because we think we can get that. And really the idea is, for all the money that the state spends on child care, we should do it well. We should do it smartly. If you're a provider, if you're a parent, we shouldn't have have to fill out 5 different forms for 5 different agencies to get the kinds of things that everybody wants to give your kids. There should be one form, it should be clear, you should understand it, you should not have to take the same information and float around. People should understand where the money's going and what we're getting from it. And that's what this whole consolidation thing is about. And you should encourage your legislators to be supportive of that. I think you can talk about it as Beth Bai's bill. They'll understand that. She's been working really hard and really well on that. There are a bunch of other issues that some of us care about. There's a workforce development bill, sort of how teachers, what kind of certifications teachers in the classrooms are going to have. There's a whole discussion about kindergarten age that continues to be discussed. And if we're going to narrow the age range, we need to provide supports for kids to be able to stay in quality early childhood programs, and that discussion is playing itself out as we speak. We talked about state-funded centers and nurturing families. If you want to get into more specific information about any of that stuff, find Sam, who's waving her hand right now. She can tell you some more of the details if that's an important issue for you. I want to talk briefly about some of the healthcare stuff that Connecticut Parent Power is working on. It's not a core issue for the Alliance, but it's an issue that affects all our families. We've been working for a couple years on something called Sustanet. There's some information about that right here. And it's really the same idea as the early childhood consolidation work, that the state should be smarter about how it spends its money on healthcare so we can actually cover more of us, pay doctors for doing the right things, keep us healthy when we're healthy, and heal us when we're sick. And it's really interesting because in the House right now, the Democrats are saying to the governor, we don't care what you say, that this is too hard to do right now because it's really important, and that you need to work with us to figure out how to do this. And the governor is pushing his budget, which is his job. And there's a lot of jockeying back and forth. So it would be really helpful as you talk to legislators, say, you know, we think healthcare is important for our kids and our families, and we want you to stand up to them, and we think that's the right thing for you guys to be doing. So there's some information on this. You can talk to me, or Heather, or George, or Robin from Connecticut Parent Power for more details about it, or Sasha, and the rest of the staff are here.